How does tympanometry differentiate types of hearing loss? Imagine being able to peek inside the middle ear without surgery. That's what tympanometry offers. It is a simple, quick test that measures how well the eardrum moves in response to changes in air pressure. This movement tells us a lot about the health of the middle ear and helps us figure out what kind of hearing loss someone might have. When the eardrum moves normally, it suggests the middle ear is functioning well, but if it doesn't, that points to a problem in that area. The test produces a graph called a tympanogram, which shows different patterns. A normal pattern, called a type A tympanogram, has a peak right in the middle, indicating that the middle ear pressure is balanced and the eardrum moves freely. If someone has hearing loss but the tympanogram is type A, it usually means the problem is not in the middle ear but in the inner ear or the auditory nerve, which is known as sensorineural hearing loss. A flat line on the graph, called a type B tympanogram, shows little or no movement of the eardrum. This often indicates fluid buildup behind the eardrum, a perforation, or problems with the tiny bones in the middle ear called ossicles. When the ear canal volume is normal but the tympanogram is flat, it suggests fluid or infection is blocking sound. If the ear canal volume is larger than normal, it might mean the eardrum has a hole or perforation. This pattern points to conductive hearing loss, which happens when sound cannot travel properly through the middle ear. Then there is the type C tympanogram, which shows a peak shifted toward negative pressure. This indicates the middle ear pressure is lower than normal, often caused by Eustachian tube dysfunction. This can happen during a cold or allergy and can lead to temporary conductive hearing loss because the eardrum can't move as it should. There are also subtypes of type A. The type AS, or shallow, shows a lower peak compliance, meaning the eardrum is stiffer than usual. This could be due to scarring or conditions like otosclerosis. The type AD, or deep, shows higher than normal compliance, suggesting the eardrum is hypermobile, which might happen if the tiny bones in the middle ear are loose or disconnected. By analyzing these patterns, healthcare providers can tell whether hearing loss is due to issues in the middle ear or the inner ear. Tympanometry doesn't measure hearing sensitivity directly but helps identify the cause of hearing problems. If the tympanogram is normal, but hearing loss exists, it points towards sensorineural issues. If the tympanogram shows abnormal middle ear function, it indicates conductive loss. This distinction is crucial because it guides further testing and treatment options. For example, middle ear problems might be treated with medication or surgery, while sensorineural loss often requires hearing aids or other assistive devices. Tympanometry is a safe, non-invasive, and fast test that provides valuable information about ear health. Always remember, if you suspect hearing issues, consult a healthcare professional for a thorough evaluation. They can interpret tympanometry results along with other tests to give you the best care tailored to your needs.